Now I'm going to perform venipuncture on the cephalic vein. I have an EDTA tube, a syringe, and alcohol.
Yep, the CD stuff. Okay.
So my holder is rotating the vein and occluding it. I've got alcohol to help clean and visualize the vein. And I've got my syringe bevel up as I go into the vein.
Okay. So it could be that that's irritating and that he needs to be on urinary dry food, but usually if you give him a cat food, it's not so irritating, and that's okay. Typically, if he's eating a cat food that's upsetting his stomach, I tend to see more diarrhea and not so much vomiting. Okay?
And hold off there.
Okay. Right. So something is causing...
Now I'm placing it into my EDTA tube.
Well, it sounds like something is causing some sort of irritation or something in his stomach.
And now my sample is ready for testing. Now I'm going to perform a PT-PTT test, and I'm going to use this Abaxis automated analyzer for that. So I've got my test here, a pipette, and I've got my blood sample, which is in a blue top citrate tube. Now you could show me. Okay, so there is my cartridge. And so what I'm going to do is pull up our software. Now I've got the patient pulled up, and I'm putting in the test. Which will connect it to our machine. So now, I'm going to turn on our machine.
Was it bad?
And we keep this covered to keep dust out of it. Okay. So I'm inserting the cartridge. Okay. And now from this package I'll get the cartridge code. I'm selecting the species. Okay, and it's just making sure that I knew that to collect this in the citrate tube. And now I'm going to put in the patient ID. And I'm typing my patient's name in. The cartridge is warming up. And this takes just a moment. Okay. Now the cartridge has warmed up, and I'm going to place 1 drop of my sample into the well. Alright, and now we wait for the results. Now I'm going to make a blood smear. I've got blood in my EDTA tube, and a pipette, and some glass slides. So I'm going to put a really small amount of blood, a really small drop. And the idea is to get it to smear really thinly and to have a feathered edge. Like so. Now I will dry the film, let it air dry, and then stain it. My blood film has air dried, so now I'm going to stain it. I'm going to have it in each of the stains for 30 seconds. Now I'm just rinsing the extra stain off with water and it'll be time to read it. I'm just blotting off the excess water. I'm going to put a drop of immersion oil. And I'm in the high power field. I'm running blood chemistries. This is a liver rotor. It has liver enzymes, bile acids, and cholesterol. So I'm careful to take this out of the package without touching the barcode, as to not interfere with the results. Place my syringe tip on. Now I've got the sample drawn up, and I'm going to place it into the well in a smooth motion, not drawing any back up with the syringe. And I'm doing this until the line where it indicates that it's full. So I have my rotor filled. I'm going to place it into the machine. And I'm bringing up the patient information here and making sure that the test is in our clinic software. Now I'm just selecting the species, my patient ID, and my client ID. And it's running. Now I'm going to check a blood glucose. Got my dog, my glucometer, test strips, and a needle. So I just need a small amount of blood. Now I'm applying the blood drop to the test strip. And I've got my result. Now I'm performing a SNAP test. This is going to test for feline leukemia and feline immunodeficiency virus. So I've got blood in my EDTA tube. And I've got conjugate. I'm going to get 4 drops of the conjugate. And 3 drops of blood. Now I'm going to invert the sample several times. Make sure it's mixed good. Now I'm going to pour it into the sample well. And I'm going to watch it, and as soon as it hits the window, I'm going to snap the test and start the timer. It's going to run for 10 minutes, and So I've started my timer for 10 minutes, and if it doesn't show up in the window within a minute, then you snap it anyway. Now I'm going to be doing a PCV and a total protein reading. So I've got blood in my EDTA tube, and I've got microhematocrit tubes. So what I'm doing is allowing the capillary action of the microhematocrit tube to draw the blood up, filling it 3/4 of the way full, and I'm sealing it with Critaseal. That's one. Same thing for this tube, allowing the capillary action to fill the tube 3/4 of the way full, sealing it with Critaseal. Now I can place the microhematocrit tubes in the centrifuge. And I'm going to balance them in the centrifuge and place the seal on the outer edge. Put the lid on. And turn on the centrifuge. My centrifuge is stopped. I've got my spun down microhematocrit tubes. And now I'm reading the PCV with this chart. So I'm going to read both and then take the average of the two. So I'm lining up the edge of the seal with the red blood cells on the bottom line and the red edge of the plasma at the top. What I'm reading is going to be where the red blood cells meets the plasma level. So here it is 44%. This one's 44% too. So the PCV is 44%. Now to read the total protein, I'm going to use the refractometer. I'm going to break the tube open and place a small drop of the plasma on the refractometer. Looking through, I can see total protein is 7.4.